Hi everyone! Today, we're going to talk about something you may not have heard of before called cutaneous and visceral larval migrans. It's a parasitic infection that can affect humans, especially in tropical areas. But the good news is, it's preventable. So, what exactly is larval migrans? It happens when parasite larvae from animals accidentally enter the human body. Humans aren't their natural host, so the parasites can't fully grow, but they can still cause irritation and disease. Let's start with where these parasites come from. Cutaneous larva. Migrans is caused by hookworms that normally live in dogs and cats. Visceral larva migrans, on the other hand, is caused by parasites called toxins, which also come from dogs and cats. These parasites usually live in the intestines of dogs and cats. Their eggs are passed out in animal feces and can survive in warm, moist soil. Humans get infected accidentally when they come into contact with contaminated environments. Now, here's an important point. For cutaneous larva migrans, the infective stage is a larva that can penetrate the skin. For visceral larva migrans, infection happens when a person swallows parasite eggs, often without realizing it. Cutaneous larva migrans usually happens when someone walks barefoot on contaminated sand or soil. Visceral larva migrans happens when eggs enter the body through contaminated hands, food, or water. Certain situations increase the risk of infection. These include playing on beaches or sandboxes, poor hand hygiene, close contact with pets, and exposure to stray dogs and cats. Children are especially at risk because of hand-to-mouth habits. Once inside the body, the parasites behave differently. In cutaneous larva migrans, the larvae stay in the skin and slowly move, causing inflammation and itching. In visceral larva migrans, the larvae travel through the bloodstream and settle in organs, triggering immune reactions. So, how does cutaneous larva migrans look? It usually causes an itchy, red, winding rash that slowly moves under the skin. This is why it's often called a creeping eruption. Visceral larva migrans can be more subtle. Many people don't have symptoms at all, but some may develop fever, coughing, wheezing, or enlargement of organs like the liver or spleen. In severe cases, the eyes or brain can be affected. To summarize the difference, cutaneous larva migrans mainly affects the skin and causes itching, while visceral larva migrans affects internal organs and can lead to more serious health problems. Doctors usually diagnose cutaneous larva migrans by looking at the skin and asking about exposure. Visceral larva migrans is harder to diagnose and often requires blood tests and imaging studies. The good news is that both conditions are treatable. Doctors use antiparasitic medications like albendazole or ivermectin to kill the larvae and stop the infection. In addition to medication, supportive care is important. This includes treating itching, inflammation, and any secondary infections. Early treatment helps prevent long-term complications. Prevention is actually quite simple. Regularly deworm pets, wash hands properly, wear footwear outdoors, avoid contaminated soil, and help control stray animals in the community. The key takeaway is this: larval migrans is preventable and treatable. With good hygiene and responsible pet care, the risk can be greatly reduced. So that's all. Thank you for watching.